We are continuing our discussion of Albert Ellis's rational emotive behavior therapy, and in this lecture, we're talking about the therapeutic process. What does ReBT really look like in practice? So the goals of ReBT are to minimize emotional disturbances and self-defeating behavior by acquiring a more realistic, workable, and compassionate philosophy of life. So you're having your clients function based on beliefs that are rational, realistic, and work for them. You're going to assist clients in the process of developing unconditional self-acceptance and unconditional other acceptance. Now, the idea is not that you simply accept things the way they are and don't seek to change things. But the idea is that you first must have a realistic, rational view of yourself and accept that as reality, and a realistic, rational view of others and accept that as reality. And once you accept that and you're thinking in a rational way, you can then bring about change where change is possible. So Ella says, life has inevitable suffering as well as pleasure. By realistically thinking, feeling, and acting to enjoy what you can, and unangrily and unwhiningly accepting painful aspects that cannot be changed, you open yourself to much joy. So the idea is that when we deny or think irrationally about things that are, we deprive ourselves of joy. We have to see things as they are, function in reality, function rationally, that will allow us to enjoy those pleasurable aspects of life, and then allow us not to fight against the reality of the things that are not pleasurable and things that cannot be changed. So another therapeutic goal is to assist clients in achieving unconditional self-acceptance, USA, unconditional other acceptance, ULA, and I apologize for this being cut off, but unconditional life acceptance, so ULA. And so you must accept the reality of yourself, others, and life. And then once you have an acceptance and you're functioning in reality, then you can bring about change where it's possible. So the therapist's function and role in ReBT is to show clients how they have incorporated irrational absolutes, shoulds, oughts, and musts into their thinking. Again, we have to realize that what we think of as demands and requirements really are preferences and desires. So we want to move clients away from this rigid type of thinking, the shoulds, oughts, and musts, into I would prefer this, I would like this. The therapist will demonstrate how clients are keeping emotional disturbances active by continuing to think illogically and unrealistically. Will help clients change their thinking and minimize irrational ideas, and encourage clients to develop a rational philosophy of life so they can avoid hurting themselves with irrational beliefs. So what is clients' experience like in ReBT? The therapist is going to emphasize here and now experiences. So the therapist is not going to devote much time, or may not devote much time, to exploring early history and how that contributes to present problems. The emphasis is going to be on what is happening here and now and what is maintaining the problems presently. Transference is not encouraged and is likely to be confronted by the therapist. Remember, the emphasis in this type of therapy is on thinking rationally, reacting to what is, as opposed to our illogical perceptions. So reacting to your therapist as if they're somebody from your past, which is the definition of transference, that would be acting illogically. So your therapist is going to expect the client to react to him or her in a realistic fashion. Clients are encouraged to work outside of therapy by doing homework assignments, and then toward the end of therapy, the therapist will help the client identify strategies to prevent or cope with new challenges as they arise. So what is the relationship between the therapist and client like? A warm relationship between the therapist and client is not required. It may enhance the process for some, but it's not a requirement of this type of therapy. What is required or recommended is a respectful relationship between the therapist and the client. And insight alone does not typically lead to change. Action is also required. So insight is important as far as it's important that clients understand how their irrational beliefs are contributing to their problem, but understanding that alone is not enough to help them change their behavior. They also have to take action to change their behaviors.